Hello everyone, we are from SGDB7. We would like to present to you our student project about psychosis and adult. These are SGDB7 members. Let us start from introduction. But before that, let me introduce myself. My name is Madi Deswari. The last three-digit student number is 118. Psychosis is a combination of symptoms that indicates inability to differentiate things that are real and unreal. There are 50 out of 100,000 people who suffered from first-time psychosis. Based on this Estes data in 2018, the estimated prevalence of people in Indonesia who have suffered from psychosis is 1.8 per 1,000 population. Gold standard medication for psychosis problems is antipsychotic medicine, which will help patients with delusions, hallucinations, and others. Medication treatment for psychosis problems become a challenge itself because administering medicine for psychosis patients combines several factors to get effective treatment results. Doctors take an important part for psychosis patient recovery. Doctor has six roles in managing patients' conditions, including clinical expert, educator, counselor, communicator, protector, and mentor, which is called six-star doctor. Family doctors should be able to implement the six-star doctor concept to get a holistic diagnosis and treatment of adult patient with psychosis. Holistic approach is the key to improving life quality of patients with psychosis and their family. These are the problems of the formulations of our student project. These are the objectives, and these are the benefits. Well, that's all from me. The presentation will be continued by my friend. Thank you.
Okay, hello, my name is Igustin Murales Starting with the digit of my name is 145. Now I will explain about the personal aspect of psychosis in adult. Delusion and hallucinations are common among people suffering from psychosis. Additional symptoms include nonsensical or meaningless speech and inappropriate conduct for the context. However, a person's conduct will frequently alter before psychosis begins. A person undergoing a psychotic episode may behave in perplexing and unpredictable ways, hurt oneself, or become threatening or aggressive toward others. Okay, that's all from me. Thank you.
Okay, so first let me introduce myself. My name is Dogun Stepratnyani with three digits serial number 044. So now we're moving on to clinical aspect of psychosis in adult. Psychosis is a reality testing disorder or loss of ego boundaries that can impede daily obligation. The DSM-5 has significant change in the diagnostic criteria for schizophrenia, requiring 2 or more psychotic symptoms for at least 6 months. A thorough mental interview is required to diagnose psychosis, involving investigation of symptoms, psychiatric history, hospitalization, and medication. An understanding of social history, suicidal thoughts, trauma, and substance abuse is important, with attention to the patient difficulty providing a brief history. Mental status examination or MSE alongside history taking is important in psychiatric interview, allowing observation of the patient, appearance, behavior, speech, mood, and state of mind. This holistic approach integrates non-verbal and behavioral cues. And the presentation will be continued by my friends.
Thank you. Hello everyone, my name is Juliana Ali. My student ID number is 20025111080. Now I'd like to continue the presentation about the psychosis in adult, especially the clinical aspect. And here now I would like to explain about how to diagnose psychosis in adult. The physical examination is very essential for diagnosing psychosis, especially in adult, including the physical examination, neurological examination, also with MSC or mental state examination, vital sign, and also BMI measurements. And these tests are essential for identifying potentially causative or contributing factors such as medication and substance use disorder, along with the patient medical history that we know from the anamnesis. The evaluation of psychosis in adult itself involves a comprehensive workup to rule out organic causes, which may include blood and urine tests, neuroimaging tests, electrophysiological studies, and even invasive procedures such as lumbar puncture. Neuroimaging, such as CT or MRI, in particular, is highlighted as a useful modality in adults with acute psychosis to screen for central nervous system pathologies or CNS pathologies such as cerebral infarct, hemorrhage, space occupying lesion, and neurodegenerative or demyelinating disease. And these physical tests and evaluation are critical for identifying underlying causes of psychosis and determining the treatment options. I think that's all from me. The presentation will be continued by my friends. Thank you.
Hello, my name is Agustin Muratatariteawarnam with the student number 20025112115, here to continue the presentation with the risk factors. So acknowledging the risk factors is vital in identifying individuals who pose a high risk of developing psychosis, which early recognition and intervention would significantly impact the prognosis and management of psychotic disorders, especially in adults. Now, the risk factors can be categorized into two main categories: the internal risk factors and the external risk factors. So I would continue with the internal risk factors here. The internal risk factor for psychosis in adult consists of personal level elements that contribute to the development of psychotic symptoms. These factors include genetic factors such as having family history of psychotic disorders, neurochemical abnormality within the brain, variations in the neurostructural aspect, and cognitive factors such as impaired executive functioning or perpetual abnormalities. That's all from me. Thank you.
Greetings everyone, my name is Idawari Sarataningsi with the last 3 digit of student number is 105, and I'm going to continue the presentations with the external risk factor. So basically, psychosis is a major psychiatric disorder in which a person's mood, thoughts, perceptions, and behavior are significantly altered. It is known that there are several external factors for developing the symptoms, but there remain uncertainty about how these factors fit together to cause the disorder. The most frequently used hypothesis is the unhealthy relationship, with one of the common type is social isolation. So the relationship between social isolations and psychosis includes psychological and neurological aspects, such as psychosocial stress or chronic stress that caused by the isolations and can alter the biology or neurobiology leading to the mental illness. Second is uncertainty and fear that can lead to an increase in anxiety levels and inability to cope with the social situations. Third, lack of emotional support that can make it difficult for individuals to cope with emotional burdens and increase the risk of mental disorder. So beside the social isolations, other unhealthy relationship can be the risk factor for psychosis in adults, such as unstable relationship and stigma and discrimination. Instability in social relationship can affect a person's self-esteem and identity. Identity problems and low self-esteem can be the risk factor for psychosis. Stigma and discriminations create high level of stress in individuals with mental disorders. Stigma can also create barriers to access to mental health care, and if a person has difficulty getting treatment or getting support, the risk for the development of psychosis or the severity of symptoms may increase, and decrease of the self-esteem can also be the effect of stigma and discrimination. Maybe that's all from me, and next will be continued by my friend. Thank you.
Hello, my name is Gusti Ayu Ika Franipanivadanti with the 3 last digit of my student identification number is 064. Today I'd like to continue the presentation to tell you about the family aspect of psychosis from its family interaction. Family is an important source of support for both healthy individuals and also patients with psychosis. Better family functioning is a protective factor for patients with psychosis. Therefore, it is very important for us to analyze and identify the family interaction of patients with psychosis. The first one is caring and love as relational strengths. This explains how the patients see and interpret their familial bonds. Next one is an engagement with the family. This includes type of involvement, warmth of the family, obstacles, and the enablers of family involvement. The next one is major familial events. Major familial events may have an impact of patients with psychosis, such as parental divorce, moving to a new home, losing a family member, being placed in a foster home, and also conflictive family. The next one is family environment style. This assesses the emotional climate of families in several ways using 3 different forms. This assesses expressivity, conflicts, independence, intellectual, cultural orientation, active recreational orientation, moral, religious emphasis, organization, and also control. That's all from me. The presentation will continue by my friend. Thank you.
Hello everyone, my name is Mita with last 3 student number 111. Today I'm going to explain about the impacts of psychosis to the family. First of all, psychosis has a significant impact on the entire family, affecting different family members in various ways and leading to emotional, physical, and financial distress for caregivers. The second one is the secrecy and concealment surrounding parental psychosis create worry and confusion among children, increasing burden and vulnerability within the family system. And the last one is parents with psychosis may struggle to teach and interact with their children due to lethargy following a psychotic episode and medication side effects, impacting their ability to be effective role models. Financial difficulties resulting from living on sickness benefits also affect their ability to provide the same material standard of living as other children.
Hello, my name is Ibu Eka Prasikasari with 3-digit last number 052, and today I will continue about family medicine approach of psychosis in adult. Primary prevention in psychosis is a vital aspect of mental health promotion, focusing on preemptive measures to reduce the incidence and impact of psychosis disorder. This approach involves identifying and addressing risk factors before the onset of the symptom. Intervention often target at-risk population, offering psychoeducation, stress management, and coping strategies to enhance resilience. By implementing this preventive measure, we not only contribute to individual well-being, but also foster a broader culture of mental health awareness and support.
Hello, my name is Nimade Medidu Febrianti with the last digit to the number 143. I'm going to explain about the secondary prevention. Finding and treating indication and symptoms as soon as possible is secondary prevention for adult psychosis. Secondary prevention aims to stop or postpone the onset of psychosis in people who are very susceptible to the illness. Secondary prevention strategies include being aware of the warning signs of psychosis and putting early detection into practice. The Prodromal questionnaire and the structured interview for psychosis risk syndromes are two screening tools that can be used. Cognitive behavioral therapy is one of the early interventions that can be used to help someone suffering the early stage of psychosis. It is used to determine whether what they are seeing and hearing is real or not. Aside from that, learning about the circumstances encountered and modifying one's lifestyle are other crucial aspects to consider. People going through psychosis can also feel understood when they have the support of friends and relatives. It's also essential to follow up with a health expert and monitor on a regular basis. Next.
Hello, my name is Gideng Rahmatawinata with 3-digit student education number 061. In this presentation, I will cover about tertiary prevention, family doctor treatment. So in tertiary prevention phase, the focus is on rehabilitation and reducing disability. Some approaches that can be taken include number 1 is social recovery therapy. Study from Flower et al. 2019, social recovery therapy enhanced social and activity outcome among individuals with early psychosis. Second, occupational therapy. Study by Rocamora, Montenegro et al. 2021, occupational therapy is positive outcome in terms of symptom elevation and restoration of occupational equilibrium. The next is cognitive therapy. Study by Montenegro et al. 2021. Cognitive therapy can enhance memory and executive processing, resulting in subsequent improvement of patient overall functional and level of participation. And last is exercise therapy. Randomized controlled trial by Skew et al. 2013 suggests that exercise therapy reducing symptoms associated with schizophrenia and depression. Also, this decrease in positive symptoms like delusional and hallucination. Okay, that's all for my presentation. Thank you.
Hello everyone, my name is Gloria Grace with last 3-digit number 162, and I'm going to draw a conclusion from the student project. So psychosis, characterized by symptoms like delusions and hallucinations, is diagnosed with DSM-5 criteria requiring 2 or more symptoms for at least 6 months. The diagnostic process involves a comprehensive mental interview and physical examination to identify underlying causes. Internal and external factors contribute to psychosis, with unhealthy relationships and social isolations triggering symptoms. Family support is crucial for coping and well-being. Prevention strategies in adults include primary preventions, addressing risk factors, secondary prevention, involving early detection and interventions, and tertiary prevention, focusing on rehabilitation and reducing disability through various therapies. These approaches collectively form a comprehensive framework for understanding, preventing, and managing psychosis in adults. These are the references that we use in arranging the student project. That's all from us. Thank you for listening.